Good afternoon, everyone. It's town hall time again, and glad that you've all tuned in to hear the latest updates. We'll start as we usually do with Steve and our opening prayer and maybe the voice. So, Steve?
Thank you, Lynn. Let us pray. God, in the midst of the confusion and the conflicting theories and ideas and thoughts and charges and countercharges, we ask you to be present to us, that even though we get concerned, we don't have a depth of anxiety that causes us to not enjoy the beauty of this world, the beauty of this community, the friends we've made, and the prospects for the future. We ask you to hear us, help us to communicate with each other and build a community that is rich in ways that give us comfort and joy and gives hope to others, including our families. We pray through Jesus Christ our Lord. Amen.
Amen.
Oh, wait. My goodness, you got shoes on now. Those are pretty sharp little shoes. Yes, I got them. They're a bargain, you know. I got lonely and I wanted to go for a walk. You got lonely? Why is that? You know, you can't go see anybody. You got to stay apart. So I didn't know what to do, so I went walking. Well, actually, you know, we're going to talk about this a little bit later, but it's not that you can't go see people. It's just that you got to be cautious and you can't be in large groups. That's not what I know. Well, actually, I've had friends invite me to watch the chapel service with them, and I've had another couple invited me to have supper. Supper? You went to someplace and ate with them? Yeah, I did, and it was a really pleasant time. I enjoyed that. You like to break the rules, don't you? No. It is okay for people to join together in very small groups as long as they're cautious. You know, you obviously are not going to hug each other. That used to be a lot of fun, you know. I know, and I miss it. But you can do this, but you got to stay in a proper distance and not breathe on each other and all those sort of things. But we need to do some more of that. You mean Lynn would let you do that? Oh yeah, Lynn would let us do that. And we're going to plan some programs to actually encourage people to get together. You have to ask Orlando for permission, right? Oh wait, I am Orlando, right? Well, all right. I guess I'll let you do it. And if it doesn't work, I'll blame you. But if it does, I'll take the credit. How's that? Well, I think that's a fair bargain. We'll go with that. But I think it's time for Lynn to bring us up to date on the things that are happening. And then maybe we can talk more about this later. Okay, here's Lynn.
Thank you, voice. Thank you, Steve. Well, everyone, as you know from reading all the calendar and everything, this is our week to be grateful. Grateful for many things. And one of the things I'm grateful for, and there are many, many, many things I'm grateful for at the Shores, but one of them is John Enders and his team. And John is our special speaker for the day. So, John, come on over. I'll move out of your way.
Hi, John. Boy,
Hello.
It's good to see you.
Hello, everyone. Well, we miss all the numerous work orders, but we are keeping busy, doing what we can do to still maintain the campus and keep everything running, doing what we can outside right now. We've actually been able to do some paint touch-up in the dining room since that's not being used. The staff is doing good. They're all in good spirits. Everybody's well, healthy. no family issues, anything like that. So we're all doing good and all supporting each other. I do ask that, once we start going back to doing some things, that we still need to abide by the guidelines. And if, somebody is in your unit hanging pictures or whatever, please, give them the distance we all need. And we'll be more than happy to do it once we get the okay to start going back to doing some of those things. Until then, we'll just keep doing what we can do, take care of emergencies. We still have the on-call people after hours in the event of emergency, so you don't have to worry that something's not going to get fixed or repaired. It will get fixed. We still have our contractors available to take care of things, so they're always there to help us out if we need it. Just need to let us know and what we can do. So that's about all I got, and we look forward to seeing you guys again.
John, just a question. Now, if for example, someone needed a light bulb or something, or hang a picture of them, that's going to wait until you get a change?
That'll wait unless the light is absolutely needed. If that is
Right.
the only light they have, then we will replace it.
Sure.
Fridge filters, we replace. Anything AC filters that need to be replaced, we do that. So we just have to kind of look to see what really is needed.
Basic essentials. Yeah.
Yep.
Okay, thank you.
Got it. All right.
Thank you very much, John. Appreciate it. John mentioned the contractors that are here on the campus. Just wanted to let you know that the contractors do come and get screened every day with their temperature check and also fill out the paperwork of the screening process, so that we are checking all the contractors that do come onto campus and then continue to work here. Some general updates. I usually, on my conference call with Management Support Services in Orlando, get a weekly update on what the statistics are in Florida regarding the COVID-19 virus. Last week, there were 43,210 cases reported in the state of Florida. Today, there were reported 46,442. So the cases continue to rise. Deaths reported last week from the virus were 1,875. Today was reported 1,997, an increase of 122 cases. And that's over a 4-day period. Previous to this, we were reporting deaths of about 75 a day. So as you can see, the death rate has slowed, which is a wonderful thing, but the cases continue to rise. This partially could be because there's a lot more testing going on, and those tests are proving to have more COVID than before we were doing all the testing. Anyway, I thought I would also give you an update on where we stand in Westminster communities of Florida. Weeks ago, I reported that there was an individual who at Westminster, Point Pleasant, and Bradenton that had gone to the hospital and contracted the COVID virus there. He then had to be put on a ventilator, came off the ventilator, had his two negative tests at the hospital, returned to the health center at Point Pleasant, and today he went home to be with his wife in independent living. So that's a victory. As the executive director down there, Tom Sutton, mentioned that was a miracle. We also had a woman down there who was at the hospital, came back to the health center, and the hospital called, said they had a false negative. She was really positive for the virus, but she's also gone home. So Point Pleasant has had 2 miracles, and we're really happy to report that. Everyone at the Palms who was on a preventative quarantine, they're all off their quarantine. The person at the Oaks in Tallahassee is also off her quarantine. The woman at Hewash Manor, which is one of our rental retirement communities, has returned from her stay at the rehab center, has had her 2 negative tests, and will be coming off her quarantine along with her husband next week. All really wonderful news.
Yeah.
And the best news of all, there are no new cases in Westminster. So obviously everything that has been put into place and all the diligent work by everyone to keep you all safe at the moment is working. So thank you, God, for that. I was on a conference call, as I am usually 3 or 4 times a week, with Leading Age Florida. Leading Age is our organization that supports nonprofits, senior living communities. And today they mentioned out of 691 facilities in Florida, only one of those facilities that's related to the leading age group has had one death of a resident. There have been no deaths of staff members on only one death of a resident. So again, excellent news for Florida. We certainly don't take this as we're loosening our restrictions and we're out of the woods, because we are not out of the woods. But it seems that we have some positive news to share. Something that's going to be mentioned a little bit later by Steve as well. One of my concerns is social isolation and loneliness. It's not a good thing for you emotionally, but it's also not a good thing for your physical well-being. We do encourage you to get out and be with some people, just not in large groups. I would say 6 people or less, all keeping social distance, but maintaining social contact with other people is critical in surviving this quarantine and this pandemic in a positive way, so that we all come out stronger. So please keep that in mind. Do go visit your neighbor, cheer them up. In that process, you'll cheer yourself up, and spend some quality time together, just not in large groups. Wear your masks and social distance. Have a little bit of news about housekeeping. We expect today or tomorrow to receive brand new vacuum cleaners with HEPA filters. We will not be doing vacuuming services, and have not, because we did not have the right equipment with the HEPA filters. We did not feel that that was providing quality services to our residents. We expect those today, and most likely by next week, after Memorial Day, we will be starting full housekeeping services back to where they used to be. It will be on your regular schedule, and it will be with your regular housekeeper. So we will put something in your in-house mailbox, a cubby box, here in Bahama Place later this week, helping you understand which is your regular day and how that will fall with a date, so that we can start back. Because there is a 2-week schedule, and of course everybody hopes that they're on the first week, but we will start with the 2-week schedule, and we will let you know what your date will be. Also, I mentioned before bed linen services, that residents will be required, if they want their bed linens changed and new linens put on by the housekeeping staff, that residents must remove their bed linens themselves and either put them right in your washing machine or put them in a plastic bag, and then the housekeeper will remake your bed. But they are not expected to touch sheets, bed linens that have been on your bed. So I just wanted to make sure that everyone was aware of that.
Lynn, let me just clarify that for you.
Mm-hmm.
I'm assuming they're putting back on linens that people already own and are clean.
Yes.
They're not bringing in linens.
No,
Okay.
no. It's your own linens. Yes, your own clean linens. Yes. A reminder that hurricane paperwork is due now, has been due. We really need to get that in as soon as possible. Our concern with it is we need to figure out numbers of who will be evacuating by themselves, who will be evacuating with the shores, because we will take a different route to evacuate this time. All independent living residents will most likely go to Camp Ithiel up outside of Orlando. But we will be doing that in conjunction with the Palms and with Suncoast. So we need to know numbers to make sure that we have accommodations for everyone. Likewise, at Allendale United Methodist Church, our assisted living residents will go there, along with assisted living residents from the Palms and Suncoast. We need to know numbers. We need to get that hurricane paperwork back into Eva so that we can start making really good plans. Please, please do that. And another plea for your help, that now's the time to plan to go on a trip away from the shores, away from St. Petersburg, and off of this peninsula. If you have an opportunity to stay with family or friends up north, northwest a little bit, you're going to be much more comfortable than sleeping on a cot or a church pew or something with us. So I implore you to please consider that as the way to evacuate. Sunrise Point, we're expecting another night pour to happen later this week. I was given the dates of the 21st or the 22nd. When I know a definite date, we will let you know that. But please know that we expect another nighttime pour later this week. And I thank you for your understanding with that. Salon Services. As you can see, the hair, I'm going to teach you a Pennsylvania Dutch word. The hair is looking pretty strubly. That is Pennsylvania Dutch for as awful as my hair is beginning to look. It's longer than it's been in years, and it's strubly. So Salon Services, we expect that they will begin next week on Monday, Memorial Day. Mari, who's one of our stylists, will be doing hair, nails on Monday and Tuesday. Jennifer will be here Thursday, Friday, and Saturday of next week. Many people have already called and made appointments, and their appointments are pretty booked. But I just want to let you know that we will only allow one stylist in the salon at a time. One stylist who's wearing a mask, who has sanitized her station and the chair, and the resident, one resident at a time, with their mask on, in the beauty shop at a time. There will not be two stylists in there. There will not be two people working on hair, or one working on hair and one working on nails. Only one stylist in the salon at a time. In addition to that, don't come real early for your appointment if you're scheduled for an appointment. We will allow one person waiting outside the salon at a time. Those are the protocols that have been set aside by all of the Westminster communities, and we are expected to abide by that. The stylists are also expected to come with a negative COVID test before they start working on residents' hair. So that is also part of our protocol. Please make appointments on the phone. Do not come and stand outside the salon and make an appointment that way. Make an appointment on the phone, because we will not allow many residents to be standing around the salon, as we don't want residents to congregate together. This goes along with the salon recommendations. So, like I said, Mari and Jennifer have already booked their schedules. But if you have always gone out of the community to have your hair done or cut or whatever, and you want to switch to services here, honestly, it will be safer to do services here, because you will know you're working with someone who has had a negative COVID test, as well as we require at least 5 to 15 minutes in between residents to have time enough to sanitize the station, sanitize the chair, so that everyone who comes in new into that chair will have everything clean and sanitized. So if you would like to make an appointment, even though you've never had the services done here, please call Eva, and she will make a list for Mari and Jennifer to add to their schedule. Please let us know what you would also like to have done, if it's just a haircut or a hair color or a perm or your nails or a pedicure, whatever. Please let us know so that we can tell Jennifer and Mari so they provide ample time in their schedule for you. Phase 2, the governor has already started a full implementation of Phase 1. Phase 2, we're not exactly sure the date that will start, but we are now preparing a protocol to start opening our main dining room. Not now, and we're not sure if we will start that exactly when the governor implements Phase 2, but it will be shortly thereafter. And again, this will be people allowed to come to our dining room and have meals like they do, but all with social distancing and with a maximum amount of people in each area. We will roll out that protocol to you when we have some more information and when we get closer to Phase 2 opening. A lot of people have asked me about COVID-19 testing. Again, I'm on conference calls a lot, and I hear lots of information from the CDC and from the Florida Department of Health and from ACA, who is our regulatory body here in Florida. I hear that the rapid tests are about 50% accurate, so people aren't recommending the rapid tests. We have had several of our communities within Westminster, Point Pleasant, and I believe Jacksonville and St. Augustine have all been contacted and are receiving tests from their local Department of Health and also the National Guard. They come in mass, 8, 10, 12 people at a time, and they are testing all the staff. They've tested the staff at Point Pleasant, where up in St. Augustine and Julington, Jacksonville, they're testing staff and residents. I'm waiting for a call, have not gotten that call yet, but if indeed we will be testing residents, independent living residents and assisted living residents and staff, I will certainly do a call them all if it's urgent, or if I have a few days notice, I will put something in your in-house mailbox. I don't have any information yet, so we will get back to you when we hear more. I have a lot of questions that come my way asking when are we going to reopen the campus? And as much as I would love to say today, it will be a while. Westminster Communities of Florida, as I mentioned before, has no new cases. That's a wonderful thing to report. And I'm not ready to just say, okay, everybody come on in. We're this good because you all are sticking with the precautions and the restrictions. I can't thank you enough. I do still have people asking me almost every day and sometimes several times a day, Lynn, would this be okay? Wouldn't that be okay if my niece just came for this or my granddaughter only came for that? The answer you're going to get from me is no. And that's because I want to keep everyone safe. Not just you, but everyone. So please, I do not know when we're going to reopen this campus. Visitors are still not allowed on this campus, and it will remain that way for a while. I've been talking for a while now about the pool equipment, sound dampening. I send a weekly email to the person that's in charge of getting that equipment ready for us. I sent one again today. And when I get more specific information about that, I will certainly share it. I just want you to know it has not been forgotten. Some people have questions about leaving the campus. We ask you not to leave the campus unless you really need to. We do get deliveries here for groceries, and some people I know have to leave. They are having treatments. for really serious health conditions. Those are the things we understand. We ask if you have to leave the campus that you only leave for a short period of time and no more than 4 hours. If it's longer than that, we don't know how many places you've been. We don't know how many surfaces and people you've been in contact with, how many touches you've had, and we don't want you or anyone else to be the person that brings this horrible virus here to this community. So please, if you're gone for longer than that, if you're gone for overnight or longer than that, we expect that you will quarantine in your home for 14 days. If you need to be gone for a longer period of time, we do keep a list of who's away from the community and who will be expected to return in a quarantine for 14 days. So please don't leave unless you really have to. And if you have to, make it as short as possible. And if you're gone for a prolonged period or overnight or longer, we will expect that you will be in a 14-day quarantine. Again, I'm very grateful for all of you. And I'm grateful for your questions because I always get questions in my box almost every day. What is our overall percentage occupancy here at the Shores in independent living and assisted living? I'm very grateful for this, and we are very blessed here at the Shores because out of all 10 communities, Westminster Shores has the highest occupancy percentage. We're over 94% occupied in assisted living and independent living, and we do have more people moving in. Please know that as people do move in, they are expected to quarantine in their new home or their new apartment or their new villa for 14 days. So that's where we are, proud of that greater than 94% occupancy. Where is Sara? And I'm sure that means Sara Feehan, F-E-E-H-A-N, I believe is her last name. She was our part-time resident lifestyle assistant. She is at Suncoast right now. We felt that as this pandemic progressed and wasn't going away anytime soon, we felt it was best that we do not have staff going back and forth from one community to another, just because we don't want to share germs. So Sara right now is at Suncoast. Bettina, who we were sharing between Suncoast and here, is here full time because we don't want her going back and forth. We also had a gentleman from the Palms who was here helping with exercises, and we asked him if he would please stay at the Palms because we didn't want, again, cross-contamination between the communities. Sara will be back. We look forward to seeing her again. We miss her. But right now she's at the Palms, and I know she's at Suncoast, and I know she misses you. When can the shredding company truck come? I know Mark is working on that, and we will get a date. Again, now would not be the time to do it, but indeed, as soon as we have a date, it's not been forgotten, and we will schedule the shredding truck and let you know the date. Please go over the rules for visiting family or friends outside of Westminster Shores. Goes along with what I just mentioned, that we don't expect you to go out and go visiting, because we don't know whoever you go visiting, if they're positive and asymptomatic and they just don't know it, but they're a carrier. We don't expect we do not allow visitors here. So right now is not the time to plan visits outside of the Shores. When meals return to the dining room, will we still be able to have meals delivered to apartments free of delivery charges? I'm not sure of that answer at this time. I will let you know. I will ask for clarification on that. I just don't know that answer, but I will try to find out. Also, the chairs in the gallery, whoever did it did a poor job. There's You can see the stuffings coming out and the vinyl is ripped in several places. We are working on trying to get new chairs for the main dining room. So we will be very careful when we choose a fabric and a company that we work with. When the governor lifts the ban on visitors to long-term care facilities, will the Shores follow the recommendations of the governor? We're conservative here. I'm sure we will follow the guidelines by the governor, but I don't say at this point that we will immediately open up our restrictions. The governor has said that even when we do phase 2, that will not mean visitors are allowed at senior living communities like ours. So I think it will be a while before we have visitors, but we will probably closely follow the guidelines of the governor, but we do definitely take a conservative approach. I will know more about that when the governor does lift those restrictions. Here's another one. I noticed Sara Fian's name was not included on the survey from the activities team. Is she no longer part of the team? She is. Just like I explained, she's at Suncoast right now, but she'll be back when this whole thing is over. And that's it as far as questions. And again, since it's Grateful Week, I like to be grateful for a lot of things. When my girls were little, after they said their prayers at night, they would always tell me 3 things that they were grateful for. Often it was an ice cream cone or being on the playground with their girlfriend or something. But I try to practice gratefulness, and I'm very grateful for all of you. And for you too, Steve, and I think the voice. So, do you have anything more?
Yeah, I do. What I'd be grateful for is a hot fudge sundae. I just thought I'd, just put that out there just in case. But because of all this restriction, and I've been hearing people say, oh, well, yeah, I didn't know you could go to visit somebody, just as Lynn has talked about. And I've had some very good experiences recently. I've had a couple invite me to come down and have refreshments and listen to the chapel service. Sometimes people are invited in to hear a town meeting on the 732 or just for refreshments sometimes. And you need to understand that's okay. Of course you should be cautious and do the distance thing and so on as you do this. But it's also, as Lynn mentioned, good to have interaction. And in that light, I'd like to give you an assignment. You can see this on Tuesday, hopefully, unless we had a little glitch last week, but hopefully Tuesday. Within the next 2 days after that, I want you to arrange to have a get-together with 2 to 4 other people, so that you have 4 to 6 people, let's say. And I'd like that all across the campus with the proper social distancing, etc. And then when you get together, I would like you to share one frustration you have with all that we're going through, but also one surprise, something pleasant that has happened because of this, just as a way of getting started. And then I want you to think of your group as a group among groups across the community, and I want you to find a name for it. You could call them the Bay Breeze Dolphins that are always leaping higher, or the Westminster Wild Ones, or the Senior Puzzle Elite, or the Slow Pace Speedsters, or the Wizards of Bayou. I don't care. Crazy name. But that will be your identity as a group, okay? And then you'll turn that in. You can turn it into me or to Ashley or to Lynn. We'll all get together about it. And once we have several groups across campus, and as many as possible, I'd like to have a whole, I was going to say a whole passel of them. I don't know where that goes. That is in Pennsylvania. I don't know where passel, but anyway, a whole bunch of them. And then we're going to have a mind-boggling, historic setting, incredible, never before experienced in history, very, very fun contest. Is he trying to get political or something? No. Listen, here's the way it's going to go. And Jan Radden gave me this idea, and we experienced it once in a meeting. you will be presented, each group will be presented with, the first phase will be 5 questions, each question having 4 possible answers. And your group will decide on the best answer of that question, and then go on to the second, and the third, and the fourth, and the fifth. And then you'll turn those in, probably to Ashley or to Lynn or to me, or maybe to Jan Radden, who's going to help me out this. And we'll count up who has, if 10 out of the 20 or 10 out of the 15 groups said the answer is number 1, then that group, whoever had number 1, will get a point. Or if they chose number 3, the majority will run the winner, all right? And we will count up the points and announce which of these groups, the Westminster Wild Ones or the Senior Puzzle Elites or whatever, get the most points, and they're the winners for the first phase. And we'll announce that here in a town meeting, and we might even get some people to come in and razz those who lost or something like that. But keep track, and then we'll go into a second phase and see if they can come back up, and we'll build this at least 3 times, maybe even more. And there'll be silly questions. There aren't right answers. They're just fun answers. Like, living at Westminster Shores during the shelter-in-place experience, 1, increases my skills on practicing solitude, or sharpens my skills in playing canasta, or make contact with distant families more frequent, or convinces one that living in a community has special gifts. That sort of thing. We'll have them at 5. You do the 5, count up the scores, put it together. We'll see who wins in all of Westminster. Then go into the second phase and the third phase. And the idea would be to keep that up for a little bit and get you to interact with each other. And then if we can get groups to interact, maybe after we've done 3 or 4 phases, then we'll let you reconfigure in different groups, because we want you to see each other and meet each other. And after that, I'm going to introduce you to a way in which we can do some writing as a way of expressing our gratitude, the week of gratitude, as Lynn mentioned, but this will be further down the road. A gratitude to the staff and what they do, and give them something that will be precious. And after that, we may come up with a different thing. The idea is to create some fun experiences with each other as we're living in these restrictions that sometimes are frustrating because they keep us apart. So we're going to work at that, but you have an assignment. And your assignment is get that directory out right after this. You see this perhaps. Go through it and pick out 4 or 5 people that you'd like to invite to get together. Now, you should stay in one group, so if somebody you invited was already invited to another group, you'll have to pick another one, so you want several possibilities. But we'll have these groups with their funny names all across campus, keep track on how they're scoring on the contest, and build, and then later on we'll reconfigure it a different way, but so that you can take advantage of this time apart to get to know each other and grow closer. So that's the type of thing that we're going to do. I wouldn't feel so lonely if they invite me. Well, you could only be invited to one group, so, not everybody could invite you. Probably wouldn't want to either. No, don't go downplaying yourself. It's okay. But we want to build a group and then eliminate loneliness on our campus. So, Lynn, anything else you'd like to add?
Well, just to close out this meeting, wanted to let you know that every once in a while, technology does not work in our favor. And there are times when we expect that something will be broadcast on 732, and whoops, it isn't there. Know that Ashley gets on a call every week with all the other resident lifestyle facilitators across Westminster and shares her concerns about Touchtown 732 and why the system doesn't work when we have it programmed in for a special time. Know that it's not intentional. Know that they try to broadcast on the scroll, letting you know when it will try to be rebroadcast. But I thank you for your understanding and your patience with the technology that we're trying to use during this time. have a great week. I look forward to seeing you either at the pop-up store or maybe soon at the salon next week. We'll keep our distance and wave hello, but I can't wait to see you all again. All right. Have a great week.
And you might start your cars and drive around the block to keep the batteries up.
That's right.
Okay, great. See
Thank
y'all.